Thank you for joining us on GBMC's Facebook page. I am your host, John Lazarou. This is our second of 3 interviews today that provide you, the viewer, with some important information during these unprecedented times. And please stay tuned because at 1:30 today, we will have our final interview that will focus on cardiovascular disease with COVID-19. But right now, we're going to talk about diabetes. For many of you that may or may not know, Tom Hanks, who is a diabetic himself, or he has type 2 diabetes, was recently quarantined because he came down with COVID-19. And because of that attention and focus, a lot has been said about whether those that have diabetes may or may not be at severe risk for coming down with COVID-19. But to separate the fact from the fiction, today we are joined by GBMC's Chief of Endocrinology, Dr. Ruth Horowitz. Dr. Horowitz, thank you for joining us and welcome to our show.
Thank you. I appreciate it.
Yeah, so let's start off real quick. You know, I think this is important not just for the diabetes community, but maybe those that are taking care of people that are diabetic or those that have diabetes. Just give us really right out of the gate some important information, maybe some safe behaviors and how to plan for COVID-19 for those that have diabetes or people that are taking care of those that have been diagnosed with diabetes.
Sure. So patients with diabetes should take the same precautions that we all should be taking. Appropriate, safe 6 feet distancing, washing hands for the requisite 20 seconds, wiping down their surfaces, and avoiding close contact with anyone, as we are all doing. Diabetics are concerned that they have a higher risk for coming down with COVID-19, and well-controlled patients with well-controlled diabetes aren't necessarily at a higher risk for contracting COVID-19. They may be at higher risk if they're poorly controlled, and patients who are poorly controlled may have higher risk for developing complications or a more severe infection from COVID-19. So we all have to take the same precautions whether you have diabetes or not.
So then my question to that is then what makes someone with diabetes potentially more susceptible to a viral infection, not just coronavirus?
Sure. So diabetics that are well controlled, whose glucoses are within target and their hemoglobin A1C is in the good range, don't really have an increased risk of having viral infections. It's those patients that are not well controlled, whose blood sugars are elevated, who might have a higher risk of developing either infection or complications. And that's because when your sugars are high, when your glucose levels are high, your white blood cells that fight infection may not be as robust. They may not be able to combat that infection. And many patients who also have poorly controlled diabetes also have other medical conditions that put them in higher risk, like kidney disease and heart disease and respiratory disease. And it's the combination of all of those factors that increase their risk of infection and complications.
I think the important word that you mentioned is controlled, but we're going to get to that later on. However, I want to ask you this question. I mean, we talk about different types of diabetes. You know, you and I have spoken about this in the past, but let's focus on type 1 and type 2. Mm-hmm. Those that are people that have been diagnosed with type 1 or type 2 diabetes, are they, are their risks any different between the two? Like, is someone with type 1 at higher risk, someone with type 2 at higher risk? Can you explain?
So, not necessarily. You know, every answer I'm probably going to give you is a little bit of a hedge. According to the American Diabetes Association and the JRDF, both type 1 diabetics and type 2 diabetics that have good control are not at higher risk for contracting the virus. Generally speaking, type 1 diabetics are younger, so they may not have the same medical conditions that a type 2 diabetic might have, who might be older and then has those additional medical factors that would be contributing. Although we now have type 1 diabetics that are 80 and 90 years old, so you know that's not across the board. But for a younger type 1 diabetic who's well controlled, they don't have any increased risk compared to a patient without diabetes.
So one of the things that we talked about earlier was how we have different measures now. You know, they talk about social distancing and being quarantined. And of course, one of the things that is always encouraged for those that have been diagnosed with diabetes is the word exercise. Of course, exercise is one way to help you, before even this COVID-19 pandemic has happened. However, given everything that's going on, let's talk about protection. How can those who have diabetes, who've been diagnosed with diabetes, protect themselves during this time especially if something that they're used to is being altered a little bit?
Sure. As many of our patients know, exercise and staying active is part and parcel of management of diabetes. And when your gym has been closed and you're not allowed to meet with your friends to go out, you need to come up with innovative ways to get exercise in. I'm sure many people have seen all the different posts on Facebook for ways to exercise with other people, do it virtually, do it around your house. I've been doing figure eights around my living room and my dining room and up and down the stairs to try to get some steps in and some walking. You can walk outside, just you want to keep your distance. You should probably walk by your alone, or if you're with someone else, you want to still maintain that 6 foot distance. And then if you see other people around, you need to make sure you keep your distance. Stay active. There's virtual yoga and every other kind of exercise that you can imagine one can find online.
Fantastic, great words. Joining us today is Dr. Ruth Horowitz, Chief of Endocrinology at GBMC. I encourage you all watching us on Facebook and on YouTube, if you have any questions, please feel free to provide them in the comments section. If you want to be a little bit more discreet, you can always private message us as well. Dr. Horowitz, we talked about things that we're doing now, but let's talk about maybe ways that we can look at preparation for let's say isolation, or if we come down with the illness. What do people with diabetes do if they've been diagnosed with COVID-19? And this follow-up to that is, okay, they've been diagnosed, now they have to be in isolation. What do they do?
Right. So clearly, like all medical conditions, you have to be prepared for an emergency. If you are unable to get out and get to the pharmacy or whatnot. So you want to make sure that you have an adequate supply of everything that you need to manage your diabetes, which includes things like your insulin, your syringes, your oral medications, glucose testing supplies, adequate forms of carbohydrate, healthy foods that should be in your pantry, all of those things that we think of in case you can't go out. Luckily, many of the pharmacies are now delivering, so if you are out of your medication or you're running low, you can get that delivered. Same with groceries, to help out people who are now quarantined. The one concern I've been reading about is if the patient with diabetes, the individual with diabetes isn't the sick one, but a partner is, or a spouse is, or someone else in the house. And you want to make sure that you take proper precautions to protect yourself from that other person who might be ill. So you might want to make sure that that person has their own place to sleep and that they have the use of their own bathroom if that's possible, and then use those same social distancing things, the excellent hand washing, the contamination of surfaces, or decontamination of surfaces, and those same kinds of precautions.
So basically, let's summarize what we talked about for the last 10 minutes is preparation is key, and exercise, we should still find ways to do it. Right. And those two are very important for people with either type 1 or type 2 diabetes.
And also, speaking from personal experience, I've been home for quite a number of days, and I've been eating lots of things that I should not be eating because I'm at home and I've got my whole refrigerator there. So patients with diabetes who are at home, who are trying to self-protect, make sure you're eating healthfully, that you're not going off the deep end or using food as a way of calming your nerves, because a lot of us do that. When we're anxious or we're fearful, we go to the refrigerator because that is a way that we help our own psyche. So you want to look for healthier ways to do that and make sure you continue to eat and cook healthfully.
All right, let's talk about healthier ways. What are some of the things that should be in your refrigerator or maybe in your cupboard? Or, of course, at my house we have this fruit basket, or this basket that has fruit in it in the island, in the kitchen. So what are some of the healthier options that should be in our home, especially not just during these times, but just in general, to have as healthier options for eating? Sure.
So, as always, diabetics should, have a balanced diet with more protein and complex carbohydrates, staying away from simple carbohydrates like the sweet items, and the carbs that are like bread and rice and pasta. Those are the things that you want to avoid a meal of. So you want to make sure you have your balance with your protein, your healthy green or vegetable that's a non-starchy vegetable, and if you are going to have a starch, a small quantity of that. So, and then snacking on things that are maybe, light vegetables or low-carb snacks are the way to go.
I shouldn't have asked this question during lunch. I'm starting to get hungry now. Joining us right now is Dr. Ruth Horowitz. She's the Chief of Endocrinology here at GBMC. I encourage all of you watching, to please submit your questions in the comment section on our Facebook page. And again, if you want to be discreet, you can always private message us as well. Doc, before we got to the program today, there was a question that came in that basically asked, what are some of the symptoms and warning signs as someone with diabetes that I should be watching out for? And what do I do if I think I've come down with COVID-19?
Sure. So the typical symptoms that we're seeing are a dry cough, fever, and trouble breathing. When we're getting to that point where we have maybe the cough and the fever, but you're not having any difficulty breathing, really we are telling people to stay at home. Take the proper precautions that we do in terms of just healthfulness, lots of fluids, stay in bed, rest. If you have developed the cough and the fever and you're developing any shortness of breath, that might be a time that going to the hospital would be appropriate. The emergency rooms are trying not to get inundated, but we want to make sure that people are appropriately going to the emergency rooms when needed. And for our type 1 diabetics, especially if you do become ill, you want to make sure that you're monitoring your glucose levels very carefully, that if your glucose levels are particularly high, that you're checking for ketones, which are a byproduct of uncontrolled type 1 diabetes that can lead to a very serious condition called diabetic ketoacidosis. And that would be if the patient also developed vomiting and perhaps very high blood sugars that are not coming down. That might also be a time to reach out to your physician, or even if somebody is more seriously ill, to go to the hospital.
So you talked about checking your glucose levels or your insulin levels as well. So there was another question that came in. Are there any supplies or medicines that people who have type 1 or type 2 diabetes should have already stock up on or should stock up on in the coming days and weeks?
Sure. So there's no evidence that we're going to have a shortage of any medications. There is no evidence from all of the pharmaceutical companies that any of the insulins are going to be in short supply. So one does not have to stockpile their medications. You always want to make sure that when we have a medical emergency or a time like this, that you have an appropriate amount of your medications, that you have your insulins, you have your testing supplies, your syringes, all the stuff, all the things that you would need to manage your diabetes in terms of supplies and medications. So a lot of the American Diabetes has an emergency plan that they have posted online, which has all the different things that one could have to protect themselves, glucose-containing solutions, and making sure you have adequate fluids, and all those things that we've mentioned before are part of the emergency kit that you should have.
Which, I like the fact that you mentioned the American Diabetes Association, and that is one of the questions that I want to ask you. What are some of the online resources that people with type 1 or type 2 diabetes can refer to? I mean, of course, you're providing some great information right here, right now. However, we do want to provide our viewers and those that will be watching us later on some additional resources for assistance.
Sure. So the American Diabetes Association, on their main page, if you Google ADA and COVID-19, they have a whole question and answer series of who's at risk, what do we do, how do we protect ourselves, what symptoms do I watch for, all the things that we've discussed. And then the JRDF, the Juvenile Diabetes Research Foundation, also has the same specific questions targeted more towards type 1 diabetics. So they're both excellent references.
You mentioned juvenile diabetes, but we had another question that came in that basically asked, children are said to have a lower risk of developing a serious illness from coronavirus. Is that true, even with children who've been diagnosed with diabetes?
Yes, it is true that children are generally at not an increased risk, even if they have type 1 diabetes, if they're well controlled. That always circles back to the degree of control. So you have, a child with type 1 diabetes that has excellent glucose levels should be the same as their sibling that does not have diabetes.
And for those that are just joining us now, let's just recap real quick. What are some of the top points that you want people to remember, not just now, but even as we continue our interview today about, coronavirus,
Sure.
And diabetes?
So the symptoms that you clearly want to look for are whether you have a fever, a cough, and shortness of breath. Patients with diabetes who are well controlled are not at a higher risk for contracting COVID-19, but patients who have poorly controlled diabetes may be at a higher risk and may also be at a higher risk for developing complications and have more serious case of complications. You want to make sure that you're testing, that you're taking your medications, you're eating well and trying to exercise. And if you do develop symptoms that concern you, to call your physician and have, when you call the physician, a list of your medications, what your blood glucose levels have been, and if it's appropriate, if you're testing for ketones, if you're a diabetic that's at risk for diabetic ketoacidosis, that you have tested for ketones so that you can give that information to your physician, and then they can be able to direct you as to what to do next.
One of the things that I found very interesting when we talked a little bit before was the diet, and again, healthy options for those who have diabetes. What should they have in their cupboard, in their refrigerator, in their snack drawer, for example?
Right. So, you always want to have fruits and vegetables, low lean calorie protein, and avoid those pitfalls like our potato chips and our cookie jar, which are the things you don't want to turn to at this time.
Joining us is Dr. Ruth Horowitz. She is the Chief of Endocrinology here at Greater Baltimore Medical Center. For those of you watching us, please submit your questions on our comment section, or again, you can also private message as well, and we'll try to get to them before the end of our segment with Dr. Horowitz. Dr. Horowitz, there was one question that came in that asked, for people with diabetes living in an area with community spread of coronavirus, is it safe to take my dog out for a walk? Since we just talked about walking and exercising. Absolutely.
Yes, I think it is safe as long as you keep that distance from other people and avoid, don't shake your hand of the other person who's walking their dog. Keep your distance, and exercise is good. Absolutely.
So we talked about, again, before the segment, we talked, with everything that happened with Tom Hanks, and of course people knowing that he has type 2 diabetes, if I'm not mistaken, mm-hmm. right? And about being quarantined and the whole conversation. Again, let's put out the facts that just because you have diabetes does not mean you are more susceptible to COVID-19.
Correct.
However, you may or may not be, because of that C word that you mentioned, controlled, and exactly. The importance of having your diabetes in control.
Correct.
True?
Correct. That is the one piece of information that is put out by all of the organizations that are informing me and that's the case for even during times when we're not in a pandemic, that patients who have poorly controlled diabetes are at higher risk for becoming ill because they don't have that normal white blood cells that are robust in fighting an infection, and they may also have other poorly controlled medical conditions. It's not because they're immunocompromised. I want to put that out there. It is because that the hyperglycemia that they have makes their white cells at that moment not be all that responsive. And so therefore, if they get their blood sugar under control, they will improve their ability to fight off any kind of infection.
You mentioned it earlier, and I want to repeat it one more time. You mentioned the word diabetic ketoacidosis. Did I say that correctly?
Ketoacidosis.
Otherwise known as DKA, right?
Correct.
So should people with diabetes be worried about DKA? So
DKA is typically a condition that happens in type 1 diabetics, although occasionally a patient with poorly controlled type 2 diabetes can develop DKA. And this is a situation usually when there's been some medical stress, they're ill or have some catastrophic event happening like a heart attack, that their body is not producing enough insulin. In a type 1 diabetic, they don't make any insulin, but in a type 2, they may not make enough insulin. And so therefore, the body turns to other sources of fuel because you can't break down glucose if you don't have enough insulin. And when you start breaking down fat, this releases an acid into the bloodstream and makes you very, very ill. So patients with type 1 diabetes, since they have no insulin, and if they are ill and their blood sugars are high and they don't give themselves an appropriate amount of insulin to manage that, can start breaking down fat and develop this acid problem.
So I know you mentioned earlier that the insulin and medication is all out there. We're not at a shortage at this time. However, for those people with diabetes that cannot get an adequate supply of insulin, what should they do, or what can they do?
Sure. So right now, many insurance carriers are allowing patients to get their medications before they normally were supposed to. This is the bane of all of our existence. You get your 90-day supply or your 30-day supply, and that's all you get. And with this situation that we're in, many of the insurance companies are allowing patients to get their prescriptions a little earlier than they normally would. And if they're having difficulty getting their medications, they should contact their physician, who would then be able to get in touch with their pharmacy and assist them in getting their medications.
Now, I know that, of course, the question is very simple. Is that a good thing? Yes. However, we don't want people getting too many, right, stockpiling.
We don't want people to stockpile, and there's no reason to stockpile your medicines. You want to make sure that you have an adequate supply so that if you're not able to get out to get your refills, that you are sort of forward thinking. But there's no evidence that we have any shortages of any diabetic medications.
So let's just recap one more time. Patients with diabetes, are they at a higher risk for contracting COVID-19?
Not if they're well controlled. If their diabetes is poorly controlled, they might have an increased risk. But if their diabetes is well controlled, they should not be at a higher risk for contracting COVID-19.
Again, I want to, when your patients call you and they say, of course, everybody is, stressed at this point. What is the number one question you might get from your patient that says, look, all this is going on, I have diabetes, what am I to do, where do I go?
So I've been getting questions from my patients. I have diabetes, should I telecommute to work? Should I use an online system? Should I be around other people? What should I do? And some of that decision making is out of our control at this time, because we've all been forced to the essential people working only. So I've been counseling my patients up until this point that if you have the option not to be in touch with other people and to work from home, to take that opportunity and to use that resource. In my patients that are poorly controlled, I have counseled them that they really should not be in contact with other people. We don't have that much option since Governor Hogan has changed the rules a bit to stay our distance. So I think that we all should be taking those same precautions and protecting ourselves.
We got about 5 more minutes left on our show today. So my question to you is, I want to start picking at certain segmented populations.
Sure.
So let's start with, again, the top 3 things that adults with diabetes should remember.
Keep your blood sugars under control, monitor your glucoses, eat healthfully, exercise, and proper sanitizing of your hands, and don't touch your face.
How about parents whose children might be diabetic? What are your top 3 recommendations for them?
Same thing, right. Make sure they're taking their insulin, checking their glucoses, making sure you're giving them healthy things to eat, get them out and running around the house if you can. I'm sure they're doing that anyway. Contact your doctor if your child becomes ill or their blood sugars are not well controlled.
How about caregivers themselves, caregivers that might be diabetic themselves, or even caregivers that are taking care of people that have been diagnosed with diabetes?
Sure. So for those who are caring for someone else who is not a diabetic and they themselves are diabetic, they want to make sure they protect themselves adequately, that they wash their hands and that they keep a distance. If you have the opportunity to sleep separately from your partner, that would probably be a good idea if you're concerned or if they have any symptoms at all. We all have those same precautions, whether you're a diabetic or not a diabetic. The difference is that the diabetic patients have to really monitor their sugars, be testing frequently, making sure that if they have any symptoms of any illness that they contact their physician so that they can get guidance as to when they might need to come into the hospital, which would be as if they're having respiratory problems, or whether they're safe to quarantine at home.
And one of the last questions I have for you is, how about those healthcare workers that are on the front lines that are also battling diabetes themselves? What is your suggestions and recommendations for them?
So, you have to be just super cautious. Use all of the techniques that we've all been taught for protecting yourself. Use your personal protective equipment. Make sure you glove and gown. Make sure that you sanitize like a crazy person. Just be cautious and keep your own health under control. Make sure you don't let your diabetes become uncontrolled while you're out there caring for everyone else.
Can you just one more time outline those additional resources for people that might or need additional information?
Sure. So the American Diabetes Association, the ADA website, if you type in ADA COVID-19, that takes you right to their lead page with all sorts of questions and answers, and it highlights all of the things that we discussed. And for type 1 diabetics, the JRDF also has the same starting web page, JRDF, and then do a search with COVID-19, and it's right on their main page. And all of the resources and links are there. I watched a video of another type 1 an endocrinologist for pediatric patients from UCSF, had a great interview, just like we just did, with many of the same questions. So it's a good resource.
So I know that they say, repetition is key. And of course, in this day and age, when it comes to health and medicine and taking care of yourselves, we can't stress the importance. So what are some of the last things you want our viewers to remember from our discussion today?
Stay healthy. Wash your hands well, sanitize your home environment, be cautious when you're in touch with each other, respect this virus, give it a lot of distance, and take care of yourself. Make sure you get enough sleep, enough fluid, and you eat healthfully and try to exercise.
All right, Dr. Horowitz. For those of you that still want to submit questions, please do so on our comments section of our Facebook page. We'll try to get to them before Dr. Horowitz has to go off and take care of her patients today. However, I do want to thank you again for joining us. Please remember that we have another interview slated at 1:30 today. We will be talking with a primary care physician about cardiovascular disease and COVID-19. Before we go, as I mentioned earlier, I want to say one more time, we have a very important event coming up this weekend on Saturday, April 4th. It is a virtual event. It's our annual Walk a Mile, which the proceeds raised from this very important activity is geared towards the SAFE and DV program, domestic violence program, here at GBMC. And because we're doing it virtually, you can do this walk anywhere around your neighborhood. You can do it maybe around the high school track. Remember, Dr. Horowitz said that exercise is key, and we hope you take some time between now and Saturday to get in that mile walk or even more. And if you don't want to walk, you can also donate. So please go to gbmc.org/walkamile for additional information. Dr. Horowitz, thank you very much again for joining us. We will see you all at 1:30. Thank you.